Hey, howdy, this is Dr. Neil Gaiman, and I'm actually here with Dr. Aaron Smith from the Stone Canyon Eye Show, up and coming YouTube channel as well. Actually graduated with him in optometry school, and we're actually combining some efforts here to answer specific questions that we get all of the time. So pretty much we're kind of spilling some eye doctor secrets, some questions you might have and maybe you've never heard some of the answers to, and we'll also tell some of the stories and experiences that we've had. So let's get into it. Now this is actually part 2 to this video series. We actually have a part 1 where we discussed if glasses can actually make your eyes worse, if it'll make your eyes dependent on the glasses. So make sure that you check out part 1 on Dr. Aaron Smith's channel, Stone Canyon Eye Show. Make sure you check that out after you watch this one. But in this video, we're going to talk about styes, home remedies for styes, because Dr. Aaron Smith actually has a unique home remedy, actually a kit that he gives his patients that I really haven't heard much about. In fact, I heard it first from him. Now, I actually have a video on my channel about styes, kind of over the main treatments and how you can get rid of them, but his is more unique, and so I wanted to put this in this video for sure. So yeah, let's do it.
Thanks, Dr. Gaiman. I'll just give you guys a quick review of what a stye is. If you've had a stye before, you'll never forget what it is, because it's this bump that can take place within your eyelid, and this bump in your eyelid can take place in upper or lower, and it is very tender to the touch. And sometimes you don't touch it and it gets so swollen that it just hurts so bad. It's a huge distraction. You get a lot of times a very swollen upper eyelid. Sometimes you don't want to be necessarily seen with a big swollen red eyelid. At work, people might think you have pink eye or a bad infection, and you're just uncomfortable. It's a huge distraction. A lot of patients get chronic styes as well, and that's a nightmare if you get chronic styes. But what a stye is there's oil glands in our eyelids. There's about 25 oil glands that span the vertical length of the upper eyelid and the lower eyelid, about 25 up top, about 20 down below. And these oil glands, the purpose of the oil is to make up the top layer of the tear, which is in 3 layers. The oil prevents the water part of the tear from instantly evaporating off the eye. So it's a very important part of the eye, these oil glands or these meibomian glands. But a stye is when one of those meibomian glands or oil glands gets infected inside and gets capped off, so that infection cannot drain. Kind of like an eye zit in a way, because you have a bunch of pus that forms within an oil gland and it can't escape. And it's very, very uncomfortable. So there's a lot of different traditional treatments out there that a lot of us do. I even do warm compresses. I recommend warm compresses for my patients that have styes. It's one of the first line treatments for styes. There's other treatments that can take place, like lancing a stye as eye care providers. Sometimes if we feel like that stye is ready and we flip the lower eyelid and we see a little white head there, and it's just, if we hit it with a needle, we can pop that thing and give some instant relief. Well, we may opt to do that, and that's a great treatment for it. But sometimes you don't have that option. It's not visible when you flip the lower lid and you're looking at the tissue called the palpebral conjunctiva underneath the eyelid, and it's just not ready to be popped. And so are there any other methods to treat a stye? Sometimes we can prescribe an antibiotic eye drop. We can prescribe an oral antibiotic. An oral antibiotic would work better than an eye drop antibiotic because it goes through the system and gets to the stye. But then you're affecting your flora and your digestive system, and that might be causing more problems if we do that. But if we use an eye drop on the eye, it's ineffective in treating a stye because that antibiotic would have to make it into the oil gland. And so one treatment that we have found in our clinic to be quite useful is a nighttime treatment. And what's done is basically we have a stye kit actually that we have put together. And in this stye kit, we have various different items within the kit. One is a gauze pad that we have the patient soak their eye with for about 10 minutes before they go to bed. They'll do and we always recommend a lid hygiene and lid washes first, but they'll take this gauze and they'll put water on it or preservative-free saline, and they'll hold it on their stye with their eye closed for about 10 minutes and soak the tissue. Kind of like you stay in the hot tub too long or in the shower too long, your fingers get kind of wrinkly. Your eyelid gets a little bit like that, where the tissue gets soft. And after it's softened, we have a breathable eye patch that we place on the eye. And we have the patient, there's different sizes also based on if you're an adult or if it's happening to a child. There's different sizes eye patches you can get, but there's an adhesive edge, outer edge to this patch, and there's a gauze in the center of that. But we have people patch their eye and they just peel the inner corner of the eye patch back, drip about 3 or 4 drops of preservative-free saline under the patch, and then seal it. And then they'll lay down and they'll go to sleep, and there's a little bit of gentle pressure on the eyelid. And if there's enough gentle pressure and that tissue stays nice and soaked all night long, then eventually, and the hope is that the gland will open up and the contents of the meibomian gland will drain out into the back of the eye patch that has a little gauze, like an eye bandage, you could say. And the eye's feeling much better and is much less swollen in the morning. So that's kind of the treatment approach. And we've seen this work overnight for a lot of patients. It doesn't work for all patients, just like other treatments out there for other eye conditions don't necessarily work for some people, and then they work well for others. But that's the treatment that we've found that works well in combination with all those other traditional stye treatments like warm compresses and things.
So you have it as a kit in your office, right? So so if a patient comes in, I have the stye, so you can actually provide them with this kit.
Yeah, we sent them home with it that day.
So they have the gauze, the breathable eye patch, and it's preservative-free
saline.
Okay, the saline that they soak the gauze in.
Yeah, and then drip underneath the eye patch to keep the eye soaked.
So soak the gauze, you put it on your eye for 10 minutes. Eyelids closed, right? And then 10 minutes, and then you take the gauze off and put the patch on, or is the gauze still on there?
The gauze is off.
Yeah, take the
and
gauze
we
off.
have had patients, we've since modified the instructions because we have had some patients think that the gauze that we had in place to soak the eyelid, they thought that gauze was supposed to stay on the eye, and they were supposed to shove it under the patch and really put a lot of pressure on the eye, which might help, theoretically, could help if they could fit it under there, but it might cause the patch to come off at night. We don't want that to happen. And I would even say that if someone's doing warm compresses, that maybe they start with a warm compress before they soak the eye, or maybe they soak the eye with a warm water bath instead of cold water, just to soften the oil that's plugged and causing that cap in the oil gland that's preventing the stye from draining.
Yeah, that's good.
It's quite involved. There's a lot of steps, but if you've had a stye,
and especially if you can get rid of it fast. I mean, because a lot of patients say, I need this gone. I have a wedding tomorrow. I need it gone right now. Like, what can I do? And you're like, oh my gosh, and you can't, lance it in the office. Right. And so obviously the disclaimer here is, if you have a stye, it's looking tender, infected, you want to go to your eye doctor, obviously, just to make sure. I mean, there's a lot of things, to consider. The infection can spread to the other parts of the eyelid or go back, and can sometimes get dangerous. And there's a lot of things involved. So I mean, obviously you're going to go into your eye doctor and everything, but it's really interesting is that, that could be a nice home remedy to consider as far as a stye goes. So that's, and I hadn't heard of that specific home remedy until I actually watched his video on his channel. So you can check that out actually on his channel. It's actually pretty cool.
And I do feel like if it's okay if I take an extra minute and talk about the antibiotic eye drops, I think that, I kind of discounted antibiotic eye drops as a treatment for styes, but if that stye starts to drain by some means, and by the way, you never want to try to pop a stye. Yeah. You never want to try to do that.
No needle to your own eye.
Yeah, just try squeezing it like a zit. Bad idea, because it pushes that infection deeper into the meibomian gland. And then when it does heal, you have a greater chance of inflammatory tissue staying within there. In other words, you'll have a bump that is not painful to the touch inside the eyelid more permanently. It could last a year, it could last 2 or even longer. But if that stye starts to drain, you've done the patch at night thing, or it just starts to randomly drain throughout the day, and that pus, because there's a lot of pus, if it starts to drain, you'll know it. That is when to go ahead and use that antibiotic very diligently, because at that point you have pus draining onto the surface of the eye, mixing with the tears, and that is conjunctivitis, is what instant eye infection, in other words, and you want to use eye drops to prevent further infection and to clear all that up.
Right.
So I'm not discounting antibiotic drops completely, but there's a time and a place for those for styes.
Right. So another thing, so so with the stye, I mean, so you have the stye that's infected. It's called a hordeolum. That's kind of what we're talking about. There's also a type of a stye, or a non-infected impacted oil gland. It's called a chalazion or chalazion, depending on how you want to say it. But also an eyelid bump on there. But there is another treatment. So if your doctor's office actually has IPL, intense pulse light, some doctor's offices will have that if they're treating a lot of dry eyes. It can help with the meibomian glands, the actual oil glands of the eyelids. But there are a lot of offices that will actually use IPL to treat these eyelid bumps, the styes. Anything that you want to add about the IPL for treating stye?
No, just that, intense pulse light is awesome because it decreases inflammation to the eyes. It can kill, has an antibiotic effect. It's a common treatment for acne in individuals who have acne on their face. It's a common treatment for people who suffer from rosacea and rosacea around the eyes, ocular rosacea. And so it's a very good treatment, alternative treatment for the treatment of styes as well. So ask your eye care provider if they have the capability of doing intense pulse light treatments in their office.
And then, if you want to, learn more about styes, I mean, I have a video on my channel about, styes, how to get rid of styes, how to prevent styes, keeping your eyelids clean, eyelid hygiene, arm compresses, kind of a lot of what people have heard about. And that's good. But it is a unique home remedy that I just wanted to bring on this channel because, I don't know, it's good to have the knowledge. So again, that was part 2 to this video series about eye doctor secrets revealed. We're pretty much sharing our tips and tricks to specific common questions. And really, if you have any questions, make sure you leave them in the comments below. You can actually tag Dr. Aaron Smith. I'll put his YouTube handle down there so you can tag him. If you have any questions for him, he'll try and answer the best he can in those comments, as well as I'll be down in the comments as well. Make sure you like this video and head over to his channel for part 3. We're going to talk about VR and eyes, a topic that I love to talk about. We're going to talk about if VR can actually make your eyes worse, tips and tricks to kind of save your eyes while you're playing VR. And it's going to be a great video, so definitely head on over there, and we'll see you in the next video. Stay focused.